Today, I've got a special treat for everybody. I'm going to interview the author of a book that talks about Medicare. And Medicare is super important for all of us as retirees because even with Medicare, our medical costs are going to be, according to Fidelity, from the time we're 65 until we pass away, over $150,000. And that's outside of what Medicare costs. So making sure we get our Medicare right, that we're signed up for the right drug plans, that we're signed up for the right plans for us is crucial. And today I've got Ari Parker. He wrote a book on Medicare called It's Not That Complicated. Ari, thank you for joining us.
Thank you so much for having me, Azul.
Ari, one of the reasons I wanted to have you as a guest is I've read many papers on Medicare, and yours is by far the simplest to understand. Your book's a quick read, and for our audience, we're going to be giving away a free digital copy of your book towards the end here. But I really liked how you made everything down to earth and easy to understand. In fact, your first chapter compares Medicare to a pizza parlor. And just quickly, give our audience that analogy.
Yes. Well, it took a while to workshop, and kudos to my wife for coming up with it. It's a delicious metaphor to think of Medicare. But the key takeaway there is if you just have original Medicare, that is Part A and Part B, then you only have 80% of your medical costs covered. You owe the other 20% out of pocket, and sky's the limit on that 20%. And so then you get into the question of which pizzerias you like to go to. And I won't steal the thunder. It only takes 5 minutes to read the introduction to the book where I discuss the pizza metaphor, but that's the thrust of it.
Yeah, and if you've read articles about Medicare in the past and you leave thinking, I still don't understand it, I read Ari's book. It takes less than an hour, and you will leave with a much better understanding. Ari, you talked about the 20%. And so Medicare doesn't cover everything. There's this gap, there's this copay that we have to pay, 20%. And unlike many of our insurance plans, there's no cap on that 20%. So how do we protect ourselves from that potential liability that could be tens of thousands, hundreds of thousands, and maybe even more?
There's two options to provide coverage for the 20% and achieve comprehensive health care. Option one is to keep original Medicare and add a Medicare supplement plan, which is also known as Medigap. This sits on top of your original Medicare and it covers that 20% you'd otherwise owe. If you go this route, you just need to add a standalone prescription drug plan so you have coverage for your medications. Then there's option, oh, go ahead.
Thanks for pausing. I was just going to say for the Medigap, there's something seniors really need to be aware of because we have a window of opportunity where we can qualify for Medigap without taking a medical underwriting. So talk to us about that. And when is that window that we need to take advantage of?
This is exactly right, and it surprises most people who are signing up for Medicare. In 46 states, there's a 6-month period when you can sign up for Medigap coverage without any questions about your health history. And this is called your Medigap open enrollment period. And during those 6 months, which coincide with when you start Medicare Part B, a carrier can't discriminate against you based on pre-existing conditions, and they can't charge you a higher price.
Okay. I want to talk about two gotchas because I think they surprise folks. And you mentioned them in your book and go over them in a way that's simple to understand. So one gotcha could be waiting to get your Medigap. And all of a sudden you've got to go through underwriting and the insurance companies can take pre-existing conditions into consideration. And ultimately you may get turned down for it. Is that right?
That's exactly right. If you're applying for Medigap coverage outside your Medigap open enrollment period, then in 46 states, an insurance carrier would get to ask you questions about your recent health history. And this isn't like a life insurance exam. There's no one who shows up at your house and takes your height, weight, and vitals. But if you've had some pre-existing condition, you would have to disclose it to the insurance company and they could deny you for coverage. So for example, even something like diabetes and hypertension could be considered pre-existing and a reason for a company to decline you.
Okay, so that's super important. Folks can find out more at your book, which we're going to leave a link for here shortly. But now I wanted to open with some of the gotchas, just because not everybody watches the complete video. So I wanted to start with that. But now let's go back to the basics. Tell us about Medicare. There's Part A, there's Part B. We skip over Part C, then we got Part D. Just give us a 2 or 3 minute overview. How does Medicare work?
Sure. If you don't like the pizza metaphor, then I have another one for you. You can picture Medicare as a three-legged stool, three parts. The first leg of the stool is your hospital coverage. That's when you're inpatient. It means you have a wristband at the hospital. If you don't have a wristband, then you're being held for observation. The second leg of the stool is outpatient coverage. That's everything outside the hospital, like visits to the doctor, visits to specialists, lab work, x-rays, MRIs, even a knee replacement. The third leg of the stool is your drug coverage. So inpatient, that's Medicare Part A. Outpatient, that's Medicare Part B. Drug coverage, that's Medicare Part D. And you need all three legs in order to have comprehensive coverage.
Okay. And what about the Part C, the Advantage Plan? Tell us what that is and why was that started?
So Medicare Advantage was established in the late 1990s as an alternative to original Medicare, administered through private insurance companies. It was designed as a way to spur competition. This is a replacement for original Medicare, and it's advertised heavily on television. So you could pick your favorite Medicare Advantage spokesperson here, Joe Namath, William Shatner, Jimmy Walker. And that's not a knock. The point is that there's a lot of advertisements around Medicare Advantage plans. In fact, in the fall, you see over 10,000 commercials per day playing about this type of coverage. And this is a replacement to original Medicare. So if you were interested in Medigap, which we were just talking about, this is different. This replaces original Medicare's network of doctors with an HMO or PPO network administered through a private insurance company. So here's where we get into the world of network restrictions, managed care, and prior authorization. And for some people, those trade-offs will be worth it. And for others, it certainly won't be.
And Ari, you work with a group called Chapter, which is a Medicare advisor. So as you're talking to folks that want to learn more about their Medicare options, high level, who are the folks that typically benefit from the Advantage plan, and who are the folks that benefit from traditional Medicare?
The people who benefit from original Medicare and a Medicare supplement plan would be people who love to travel, people who own a second home in a different state, people who don't want to be constrained by network restrictions, people who own an RV, and the list goes on. So someone who doesn't want any restrictions on how they use their coverage and just wants to go to the doctor that they want to see when they want to see them. People who would benefit from Medicare Advantage, and it's one or the other, by the way. You can't choose both. People who would benefit from Medicare Advantage would be those who can't afford the premium for a Medicare supplement plan and instead prefer all-in-one coverage. Most of these plans include drug coverage at a lower cost than what they would pay for Medicare supplement. So the premium for many Medicare Advantage plans is as low as $0, but you still owe your Part B premium, which is $185 per month for 2025 to Uncle Sam. So you continue to owe your Part B premium even if you choose Medicare Advantage. But you see the use case here. The use case would be someone who's in relatively good health, who is on a fixed income. That would be the demographic who tends to choose Medicare Advantage.
So talk to us, if somebody chooses Medicare Advantage, is it pretty much once for a lifetime? Is that a decision that they should quote unquote marry, or is that something they can change their mind about in the future?
I appreciate you bringing up one of my slogans in the book, which is marry your Medigap, date your prescription drug plan. The dating period also applies to Medicare Advantage. Every year, you want to evaluate whether the Medicare Advantage plan you've been on is right for you for the upcoming year, because there's lots of competition here and there's new entrants to the market and your healthcare needs may have changed. Now, in terms of switching between Medicare Advantage back to original Medicare, the time to do that would also be in the fall. But if you want to get a Medigap plan, then in 46 states, it's going to be constrained based on your health unless you have a Medigap guaranteed issue protection that applies, which are few and far between.
So people need to be really, really careful when they make that traditional Medicare versus the Medicare Advantage plan.
That's exactly right.
Because of that, really because of the 20% that's not covered under traditional Medicare and qualifying for a Medigap plan that would cover that for them. We basically have a window that we need to be cautious about. And once that's gone, it doesn't mean we can't go back, but we may not qualify for the Medigap, or it might be prohibitively expensive.
Right. People who are starting Medicare want to think of this as a long-term purchasing decision. Actuarial tables suggest that if you're turning 65 today, you have a 50-50 shot at living until 100. So whether you choose Medigap when you first turn 65, you want to be thinking not just how your health is today as a 65-year-old, but how your health will evolve as a 75 and an 85-year-old. Because in 46 states, it's a one-time Medigap open enrollment period when you first start Medicare.
Yeah, now nothing we're sharing in today's video is advice for any specific person. For that, they should reach out to a Medicare advisor like Chapter or one of the other folks. But when somebody calls in, why would somebody? So I've got the beginning when you first qualify for Medicare. But on an annual basis, we talk about your book mentions that quote, marry your Medigap and date your drug plan, date your Part D. Why would somebody want to reach out to a Medicare advisor on an annual basis?
Because your health needs may have changed, and the plans themselves are changing if we're talking about Medicare Advantage and standalone prescription drug plans. On the Medigap side, those are standardized under federal law. So the benefits for your given Medigap plan letter type don't vary, even based on the insurance company that you choose. It's the same hospital and medical benefits under law. And so that's the distinction that we get into. And that's why it's so important to review your healthcare needs every year, because even if you're taking the same prescriptions as you were last year, just by taking 15 minutes to review the standalone drug plan that you've been on or the Medicare Advantage prescription drug plan that you've been on, you can save thousands of dollars and also find a better fitting plan based on your needs.
So your drugs might change. The plan D that you're on, the drug plan, they may change the drugs that are offered or what the copays are going to be. That can change every year. Is that correct?
Yes, that's right. And for this year, there was a major change that went into effect on the Part D side. For the very first time, there's a maximum out of pocket on your prescription drug costs. It's only $2,000. Previously, there had been no maximum. So some seniors owed over $10,000 for their prescriptions. But for this year, if the plan that you're on covers your list of prescriptions, then you are subject to that $2,000 maximum out of pocket. If the plan doesn't cover all of your prescriptions, though, then those prescriptions that are outside of your Part D plan aren't subject to the cap.
Okay, great. And some of this might be sounding complicated to folks. And really, our goal today is to put things on your radar screen for you to be thinking about. And one of the things to think about is, does it make sense to reach out to a Medicare advisor? And I think it does. There's no cost to us as consumers. And the plans change and the cost of the plans can be different. And that's why, Ari, when your partners reached out to me and said, we'd like to sponsor your channel, Azul, I said I was excited to do it. And I'm also excited to be able to give people a free digital copy of Ari, your book. Chapter was kind enough to do that. And folks can get a digital copy at this link here. And it's a free digital copy. And in fact, I put a forward in the digital copy just because I'm such a fan of Chapter and I'm a fan of your book, Ari. So you can find out more there. So, Ari, this gets complicated, but I want to go back to why people should consider reaching out to a Medicare advisor on an annual basis, even if they're on traditional Medicare. We talked about the Part D, we talked about prescriptions, and that can change. And you just mentioned a major change that happened this year to Part D, where there's now a cap on how out-of-pocket costs on an annual basis. But let's talk about the Medigap. my understanding is while the Medigap plans are all the same by the letter, so if you have a plan G, it's going to be the same coverage no matter who sells it, but the cost can change. And is that one reason why it might make sense for people to reach out to a Medicare advisor just to make sure they have the best, the most cost-effective plan?
That's right. So there's no cost to work with a Medicare advisor. So if it would be a benefit to bounce your thinking off of someone, then you should consider using someone who's independent and unbiased. And when you're working with someone, you just want to make sure that they can help you evaluate all of your options. Because as you mentioned, Azul, each Medigap plan letter type is standardized under federal law across their hospital and medical benefits. So what they're really competing on is pricing, marketing, and how the premiums vary over time. Wouldn't it be helpful to have someone who has this data set at the touch of their fingertips in order to help you compare your options and perhaps help you save a few bucks?
So let me give you a second to talk about chapter and how you guys have made sure that you have all the various plans and that the data is correct.
Yeah, this is a huge data and engineering problem in order to gather all of the specific data points across hundreds of insurance companies offering thousands of plans. This might surprise people, but though original Medicare Part A and Part B come directly from the government, in terms of your additional coverage, there's over 24,000 different plan options nationwide, and they vary zip code by zip code across the United States. And it'll vary based on the doctors you see, the prescriptions that you take, and your priorities. So that's exactly why working with someone who's independent, unbiased, and has all this information available could be helpful to your audience.
Yeah. And Ari, I just want to share quickly, when your partners reached out and said, hey, how would you feel about us being a sponsor? As I talked to your founder, I got a sense of how important the data collection and just making sure you have all the policies and correct information. I just assumed the government ran that database, but it turns out you guys built your own database to make sure you had the right data.
We had to, because if you go to Medicare.gov and you're interested in Medigap, for example, it'll just show you a range of prices. It won't show you which insurance company is offering that price. But wouldn't you like to know that?
Yeah.
On the Medicare Advantage side, if you sort your options on Medicare.gov, it'll show you a list of all the plans available in your zip code. But if you try entering in your doctor, it won't show you whether the plan accepts, whether you can go to that particular provider under the plan that you're considering. So there's other problems that I can get into, but those are two biggies that I just wanted to mention.
Let's go ahead and get into a couple more of the big problems that can be helped tremendously by having a strong data set.
So Azul, for this one, let's go through the 3P framework, which I write about in the book. You need all 3Ps. The first P is your providers. You want to make sure that the plan that you're considering accepts all of your doctors, because that is a red alert if one of your doctors doesn't accept the plan. You may have a long-standing relationship with them, but if they don't accept the plan that you're considering, you won't be able to see them unless it's an emergency. The second P is your prescriptions. This varies based on the medications that you're taking, brand name or generic. It also varies based on the pharmacy that you like to go to. The pricing varies enormously on whether that pharmacy is considered preferred, standard, or out of network. And then the third and final P is your priorities. What do you like to do with your time? Do you have a second home in a different state? Do your grandchildren live elsewhere? Do you like to travel? Do you plan to travel abroad? All of this factors into finding the right coverage.
Very helpful. So let's talk about that last P, your priorities. And one of the things, my audience likes to travel. Some folks are thinking about living abroad. And before I ask the question, I just want to remind folks that they can download a copy of your book, Ari, at this link here. It's a free digital copy, and you can also connect with Chapter through that link. But let's talk about traveling. Does Medicare cover you when you're in Europe, when you're in South America? If let's say you're going on a 2-week vacation, does it provide medical coverage then? And also, what happens if you move to France, Spain, or Peru? What happens to your Medicare coverage then?
Two very different use cases. So first, let's address people who are just traveling abroad for a 3 to 4 week vacation. There's no coverage under original Medicare if you need some type of medical support while you're traveling abroad. However, if you choose Medicare Supplement, which is also known as Medigap, then certain plan letter types offer 80% international coverage when you're abroad for the first 60 days that you're outside the United States. Now, this is subject to a $50,000 lifetime limit, but this went a long way for a client of ours who was vacationing in France. They suffered a heart condition. I think I write about him in the book, but I'm not positive. It definitely got picked up by the Wall Street Journal, though. And he needed $30,000. His hospital stay cost $30,000. Through the help of our member support team, we were able to get $24,000 in reimbursement for his hospitalization, so it didn't ruin his trip. Now, for expats, people who move outside the United States, this is a different use case. So their Medigap plan isn't going to help them because they're spending more than 60 days consecutively outside the United States. A Medicare Advantage plan could help them if they need urgent care potentially, but really the consideration is going to be whether they should take Medicare Part B or not.
Okay. Okay. Yeah, and it's one of the things this gets complicated, and one of the things when people are thinking about moving overseas, making sure you have Medicare coverage is key. Even though it's lower cost in other countries, if you have a chronic disease, if you have something that's expensive, even if it's 20% of the US, those dollars can really add up quickly. I want to add another use case here. But first, I want to remind people that you can get a copy of your book at this link here. It's a free digital copy. Ari, I live in a town right now where there's a lot of military people.
Mhm.
And I was telling a friend of mine that's retired military that you and I'd be talking today, and he's said, please ask this guy this question. And it may be too specific, but the retired military people have TriNet. And his question is,
Tricare for life.
Tricare, thank you. How does Tricare and Medicare work together?
Tricare for life is for retired service members. It means they served our country for 20 years or more. So thank you to your friend for his service to our country. They get a free Medicare supplement plan from the Department of Defense. The only thing that they need to do is activate their original Medicare.
And does that happen automatically?
No,
Activate.
they need to apply to activate their original Medicare. So this is a point of confusion for our retired service members. But there are, unfortunately, insurance companies that try to sell these retired service members additional coverage. And the reality is they don't need it because they get a free Medicare supplement plan from the Department of Defense by virtue of their service to our country.
Okay, so they would just call the Social Security office and say, I want to start my Medicare coverage.
Best way to do it would be to apply online through their Social Security account. It's fast, safe, secure, and it takes less than 5 minutes in order to apply to enroll in Medicare.
Okay, and I've got one more. I want to end our interview on a potential gotcha, which is some in my audience love their job. They're not going to retire at 65. They're going to continue to work. Their company offers a great healthcare plan. What's the gotcha for people that continue to work past 65 and don't sign up for Medicare? Is there anything they need to be careful about?
People who are working or on their spouse's coverage past age 65 just need to be cognizant of the size of the employer. If you or your spouse work for a large group employer, which is considered 20 employees or more, then you're free to remain on that insurance and it'll be primary for you. However, if you work for a small employer, meaning 19 employees or fewer, then you need to start Medicare by way of turning 65.
And what happens if they don't? So they're working for a company that has 10 employees. They don't start Medicare and they retire at 70. Can they start Medicare then?
This is unfortunately all too common, and I write about it in the book. And the problem here is twofold. The first is that if something happens to them between ages 65 and 70 before they apply to enroll in Medicare, then they're not going to have primary insurance because Medicare is designed to be primary to that small group health insurance. And so they really need to start Medicare by way of turning 65. And also, they might be hit with a Part B late enrollment penalty. So that's the second rub.
Yeah, and if Medicare is supposed to be primary and you're working for a small company and it's not primary, your company's insurance can actually go to you as an individual and say, you were supposed to have Medicare, so you're responsible for what Medicare would have covered. Is that correct?
That's correct. And it
That's,
can cost tens of thousands of dollars
yeah.
depending on how your health has evolved. And it's really an avoidable mistake. Just be aware that if you or your spouse work for an employer that has 19 employees or fewer, then Medicare is designed to be primary.
Okay, I want to remind folks again, you can get a copy of Ari's book at this link here. And Ari, we talked about how failing to sign up for Medicare can cost, or doing it incorrectly can cost thousands, tens of thousands of dollars or more. It can also cost lives. And I want to give you a chance to tell your origin story. You're a Stanford Law graduate. There's not many Stanford Law graduates in this industry. Why did you decide to devote the early part of your career to this?
Well, I decided to devote my time and energy towards educating people about Medicare because of my mom and dad's experience. And I write about my dad in the conclusion to the book. And my dad was a physician. He passed away 3 years ago, but he lived abroad. He was an expat. And he thought that he didn't need to start Medicare Part B because he could get whatever he needed when he was outside the United States. But he suffered a serious medical condition while visiting me in the US and my brothers. And he decided to wait until he left the country in order to get it treated. And he actually died 90 minutes outside of Tel Aviv on his flight back to Israel.
I'm sorry for your loss. And you know, through chapter, through your choice to work on this, hopefully you're reaching thousands of people, tens of thousands of people, and helping them avoid a loss like this and also making better decisions so that they can just enjoy their retirement. We've been speaking with Ari Parker. He's the author of It's Not That Complicated, one of Amazon's best-selling books on the topic, and you can get a copy of his book at this link here. Ari, thank you so much for joining us.
Thank you so much for having me, Azul.